Hey everybody, Scott Raffa here. We're going to talk about another article, another topic. It's going to be on minimally invasive spine surgery. The question is, what is it? What is minimally invasive spine surgery? What does that mean? What do you do when you talk about spine surgery, small or large, and so on? So I think the biggest question is how do you define minimally invasive spine surgery? Well, there's probably two ways to define it, one of which is more technical based on what you're actually going to do to the body, the spine, and how you do a surgery, more so kind of the approach of actually doing the work that needs to get done. The other is probably more of a kind of a thought process, I'd say a philosophy or a mindset. You're basically thinking, how can I decrease the burden here physiologically? How can I decrease the toll onto the body, onto this person, and what it takes to get the job done, to get them better? You know, you don't have to do big, wide open surgeries, you know, these old school techniques where you expose and look at everything. You can really downsize all of that to make really small incisions, really small kind of angles, how you get there, the trajectory, and really get the same or even a better result. So that's really what the philosophy side of things is. But the technical side of things, how you do something, is quite nuanced. There's a lot of language there that we don't necessarily have to go into. It really boils down to smaller incisions. I'd say number one, smaller incisions. It boils down to just not having a large exposure, is what we would describe that as. Being very careful to the soft tissues, treating them very kindly. You know, these muscles are very achy. We do everything with our muscles, even if we're just sitting up like this, head to toe, the whole thing's engaged, it's working really well. So you don't want to be very ginger with those as you do the work in the neighboring areas. You don't want to cut them or burn them, God forbid. And then when you're there, you're working through more than one aperture, not just one big exposure. You're probably working through small little access ports and so on to get the job done. You're approaching the spine in some different ways with some different technologies like navigation, which we could talk about in a different article, how you actually see where you're going to go through space and through the body without having to expose it. So I'd say that's probably what minimally invasive spine surgery to me means. There's two ways to think about it. One is the technical way, so we're going to dive into that for hours, I'm sure, as you keep watching. And then a mindset of saying, hey, how can I really approach this problem not with a cookie cutter, full-sized solution? How can you downsize things into small, kind of very compartmentalized solutions, take care of the patient, have decreased infection risks, have better quality of life afterwards, better burden onto the soft tissues, less muscle pain, less hospitalization. I mean, there's tons of great data that support that idea, that approach to spine surgery. So again, two different ways to talk about it. Minimally invasive spine surgery. I hope it helps. Talk to you soon.